A little bit. That's it. Good. Drop. Good. Move it.
Ah, yes. Yeah, exactly.
Stay up.
Yeah.
Good. All right. So thank you both for coming. Appreciate it.
I'm so excited.
Yeah, me too. All right. So let me just give you a rundown of what's going to happen. Just see what's going on with you. We're going to take a little bit of a history, see what's bringing you in, and then afterwards take some X-rays, and then we'll get you adjusted.
Okay.
All right. So Alexandra or Alex, you go by Alex.
Yeah, Alex.
Okay.
Mm-hmm.
Guys, you're coming from Austin.
Yes, I am.
Nice.
Yep.
All right. So tell me what's going on with you.
Yeah. So I just experienced for me now it's normal, neck pain when I go like this. There's always a strain on the back of my spine right here, and it's always when I wake up.
Always when you wake up.
Yeah, but then it seems to loosen up.
Okay.
As I go out throughout the day.
Mm-hmm.
But why I'm here and why I got interested in this type of service is because I had back spasms a couple months ago, and it really restricted my movement.
Mm-hmm.
So I was at work, I could barely move, I could barely go down the stairs, and I had to lay on the floor and do yoga stretches for about an hour.
Yeah.
Yeah.
That's awful.
So
How long did that go on for?
Not long, about maybe 3 days, because I went into a walk-in chiropractor and I was like, please, something. But he didn't take an x-ray or anything like that. So I just, I do yoga, I work out regularly. It's just the matter of stretching, I guess, I need to work on.
Gotcha.
But yeah.
Yeah. And I think a lot of times when people experience some sort of spasms, right? Yeah. So there's one woman that I'm thinking in particular. She comes in, she's in about her 50s, 60s, and she literally can't even she couldn't lay back because it would just spasm so hard. So a spasm is really just a defense mechanism, meaning that there's something that's going on in your spine or in that area that your body doesn't like, so it spasms those muscles around it to protect it, right? So if you were to break your leg, or I were to break my leg, the first thing that we would do is what? Splint it.
Yeah.
Right? You want to immobilize it. Mm-hmm. So the spasm is a way of your body's immobilization technique in that area. So it's if you move me, it's going to be worse and worse and worse and worse. That's why when you stretch or he did an adjustment on you, you felt a little bit better because it restored that type of motion in there. But what worries me is that there might be something else that's going on in there, right? Mm-hmm. So that's what we have to find out.
Yeah, and I also get migraines.
Yeah, that's not good. How often are you doing that?
Honestly, it's at least once every 2 weeks. And it can range from I need to, I'm queasy and maybe I'll throw up, versus okay, I'll just close my eyes, be in the dark, and it passes. But it's too frequent for me. It's not that bad, but it's not normal. So I'm just curious. Does it have to do with?
Absolutely.
Yeah, right?
Yeah, absolutely. So we see people, how long have you been dealing with the migraines for?
It's gotten worse probably within a year, honestly.
Within a year? Yeah. When is the first time you experienced it? Or headaches just in general?
Probably college.
College?
Yeah. But then it got worse as I started my working full time. Yeah, and I work at a desk job. I stand, but my monitor is not eye level for me. It's a makeshift stand. So I feel I'm looking down a lot and I'm looking at screens all the time, and it's just.
I get you. I mean, when I edit and I do all my things, my neck just kills me.
Yeah.
All right. Mm-hmm. But there is hope. I'll tell you that. Right? There is hope, and a lot of time. One, having migraines isn't normal. Mm-hmm. Depending on what study you see, the average amount of normal headaches or migraines per year is 1. Yeah. 1 to 2.
Oh my gosh.
Right.
Well,
you're I surpassed that last week.
Love that for me. Yeah.
But a big reason why people come in and they're having migraines, I've seen people that are 30, 40, 50 years of migraines and headaches, and the biggest reason why I see it is because of how that neck is positioned. Yeah. When that neck is positioned in a really bad way, and the fact that when you are waking up with that type of tension, that's not good to begin with, right? So something has to be done to change it. Now, when you look at any lower back issues, mid-back issues?
It's mostly I will say it's mid-back, honestly, where my bra strap is. So there's always pressure there. And so for a while I had to stop wearing things like that because it would just make it tighter and tighter. So after I had my back spasm, I was no, I need to not wear anything because I feel it's making it worse.
Right.
So I don't know, is that normal or is that
I think no. I think what the biggest thing that's going on with you is, so when I see somebody and they have this issue and they have this issue, they're connected, right? When you look at somebody, and I'll explain, there's so many things in my head that I want to explain to you, so I hope you convey this right. Okay. When you look at somebody first from the front, right? And if you see my videos, you see my sketches.
Yeah.
But you want to see.
Here we go.
This spine should be straight like this, right? From the side, you want to have curvature. So you want a curvature that goes this way, a curvature that goes this way, and a curvature that goes this way. From here up is your neck, right? From here to here is that mid back, and then from here down is your lower back. Now imagine this. Imagine there are muscles here, and that muscle is 6 inches. If this curve moves forward like that, does that muscle still say it's 6 inches over here? No. This muscle becomes more like 8 to 10 inches, right? So when it becomes more like 8 to 10 inches, it doesn't just affect this, right? For every action, there's an equal and opposite reaction. So if this moves forward, what do you think happens to this?
Does that move
backwards?
back?
Right. So it moves backwards even more, right around where your bra strap would be.
Okay.
Right? And so when you're sitting like this, right? Say this is good posture. You have everything, all the curves are there. Your body, you can't do that for 8 hours a day or 7 hours, even 6 hours. You know, your body starts to be like, okay, I gotta slump a little bit. And the thing is, you don't go from this to this. You go from like this, and then it progressively kind of gets worse. And you can see that my head starts to move forward like this, right? And then this starts to move forward like this. And then you have this what we call a hyperkyphotic thoracic curve in this area that's pushing too far backwards. And when you talk about your spine, and you talk about just your body in general, it's all about how your weight's being distributed. So when your head is moving forward a lot like this, all the muscles that are here are being stretched out, they're being tensed, and then consequently the nerves that are coming out of those areas are now being compressed, they're being pinched, they're being pressured, and that's causing what's happening here, right? So it's an abnormal, and I can see how your shoulders are forward and your neck's like this.
I'm very tense. Like,
you're very tense.
Always up here, and I don't know. Even when I get massages, it doesn't help. They're like, you need to calm down. Like, you're very, very tense. I don't know how to not be tense.
And it's your body's way of just fighting against it, right? Because there are discs, and the discs are there to help your body. But the thing is, if your head's too far forward this way, it generates those discs a lot faster because it's not set in the right way. It's not balancing it in the right way. Once you're able to pull this back this way and push your chest back up this way, that's where you finally find a true relief, right? So, and I'll make, and it's possible. But the difference between getting an adjustment, right, and I just want to stop with the myths and just basically tell you what an adjustment is. Adjustment won't return a curve back. An adjustment won't, quote unquote, align you or straighten you out. What it will do is reestablish motion in between those areas, in between those joints, which then allow the nerves to fire the way that they're supposed to. So it's that movement. I mean, imagine if you were never to move again for the rest of your life. How would you feel? Awful.
Terrible.
Right? You would feel terrible. So this allows more motion to be restored in there. Now, there is a way to get this corrected. Right. I don't know what your neck looks like. I don't. I am willing to bet though that that's not there.
What if we get the X-ray and it looks totally normal?
Then that's a good thing.
Right.
That's a good thing.
Okay.
Because if that's the case, right, then what needs to happen is that there just needs to be motion restored in your entire body. Right. And that's it. Right. If you don't have a curve, then we use the dental roll. If you do have a curve, then you're good. That's what you want. I don't want to find something. Right? I really don't. But the thing is, 9 times out of 10, and what experience has taught me is that most often than not, when people have what you're going through, the migraines, the headaches, the neck issues, there's definitely loss of curve in that area.
Okay.
All right?
All right.
I don't mean to be the bearer of bad news.
No, I'm happy to be here. I'm like, please help me. I'm ready. I've been waiting 2 months.
Good. I'm glad. All right, so...
How it started was I found you on YouTube, and then I sent the video immediately to my sister. Tori, and I was like, yo,
both got into it.
He is in Houston, we need to do this.
Well, I'm so happy you guys decided to. Right? With you, you have, both of you have that reverse curve, right? So we're going to, I have to set up just a little bit different.
Okay.
So I have to extend your head back and then pull. So we're going to turn and let your head bend this way. And once you relax your shoulder, good. Let your head fall down. Let it fall down. Feel that movement?
Immediate difference. Like, I need this side immediately now. Wow.
Yeah?
Yeah.
That was good, right?
I was worried that, like, I'd be one of those people who can't, like, rest their head in your hand because it feels so tense. So, Glad
That was good. No,
worked
you
out.
did great.
Thank you so
That was
much.
good.
You did great. 100%, yes.
We're gonna turn this way. All right, so that's about your limit right there.
Okay.
Which is not good, but that's what we're doing here. Turn. That's it. And I want you to let this fall more. Drop your shoulder down. Good. I want you to fall a little bit. That's it. Good. Drop, drop, drop.
Wow. That one was crunchy.
It sounded crunchy.
That was a lot more crunchier, right?
Yeah, it was. It was.
Yeah, that
Oh
Wow.
my gosh.
that was the one that was the biggest one
Yeah.
that you needed to get.
Okay.
For sure.
Thank you
Good.
so much. Yeah, I'm good.
Adjust this area
Alright.
in here. I want you to tilt your chin up a tad bit. Good. So you see when I press right here, there's not like a lot of give compared to like, well, this whole spine is, but but like down here, there's some give.
Yeah.
And here, there's like nothing.
Mm-hmm.
So I'm gonna press right there first,
Okay.
okay? So I want you to take a deep breath in for me. Let that air out. That's it. Look up a tad bit there. Let your shoulders relax more. Let that go.
Oh, yes. That's awesome. Yeah.
That just radiated all the way up there. That was good.
Yeah, that was amazing.
Yeah, we're gonna
Yeah, I'm out already.
keep this bent like this. Keep this straight forward. That's it. So I just want you to take a deep breath in here and then exhale. Let that go. Good. I want you to take this, pull this down a little bit more. There he goes. There you go. So take another deep breath in. Let it out. Let that hip go more. Good.
Oh,
You alright?
yeah, that's what I needed.
Good.
You're gonna love this.
I am already loving it.
So you're gonna keep this above your head, just like that. Leg hang off.
Okay.
Let that go. Let that fall. Feel that more? Good. There it goes.
Wow.
You didn't even give me a countdown on that.
No.
You said you need this right now. Alright.
Good. Stay right there.
Okay.
Sometimes it's the best way to do it, to be honest with you.
Mhm.
So we're gonna let your head come all the way up and go down. Good.
Okay.
Good. How does that feel?
Yeah, I already hear and feel
Right.
things.
Feel
moving.
things? Yeah. Good. Just relax your traps. Relax your shoulders. That's better. Feel that difference?
Yeah.
Good. So I want you to take a deep breath in. Let that air out. Good. Put your hands on your chest. There you go.
Ah, yes.
Yeah.
Yeah. Thank you so much.
You're welcome. Your sister's like, oh.
That was not nearly as bad as I thought it would be,
Hmm.
but I don't think I can move.
Yeah, just
So-
just stay there. just stay there for a minute.
Okay.
Just stay there for a minute.
Okay.
That looked great.
Oh my God, it's wow.
Lift your head up.
Yes, thank you.
Good. Stay right there.
Whoa, it's kind of sore,
Yeah.
but I think it was necessary.
Yeah, whenever your neck's curved that way, it's
Yeah.
gonna be, there's a lot of scar tissue that's kind of just built up that way.
Okay.
Wow.
Wow. Yeah.
Yeah, just stay, I mean, the soreness kind of just goes away. It's just your body's just trying to reprocess everything.
Yeah.
So stay there until you're ready.
Okay. I think I'm okay.
You think you're okay?
Yeah, I'm good. I'm
Hang
good.
tight for a minute.
Okay. Whoa, my neck.
Are you still cracking? Shoot.
I probably am.
Yeah. How do you feel?
I feel pretty amazing.
Yeah.
Yeah, it's a little sore, not gonna lie.
Yeah.
But better. Release some tension. Mm.
Yeah, and it's gonna be just for maybe like a day or two.
Yeah.
But I'm telling you, I think it's gonna do great things.
Okay, cool. I trust you, so.
Yeah.
Mm.
Yes.
All right, stay right there. We're gonna
Okay.
do one more thing. This is just gonna help reduce some of the inflammation in the neck.
Okay. Oh, I haven't seen this one come out.
Yeah. This one kind of gets left out sometimes.
Okay.
It's the unsexy part of it. So I'm gonna have you look all the way up. Good. Good?
Yeah, perfect.
The cherry on top.
Yeah, the cherry on
Cherry on the top.
Oh my gosh, love it, girl.
Wow. Thank you so much.
You're
All
welcome.
right. Yes,
Feel
and
more
thank
relaxed?
you too. Yes.
Good.
Oh my
Have a
gosh.
seat.